Hello, everyone. Your breakout session for orders. I'm Lorraine, hosting today. A few things before we get started that you should know. Our presenter this morning is going to be Liz Lees with Root Cause of Arizona. We have an hour for the session here, including the questions and answers, so you'll have plenty of time to do that. Please silence off your phones. If you need to step out, do so quietly. And if you go out the door past the elevators to the right and left are men's and women's restrooms. We do encourage your participation. If you have any questions, raise your hands. And I'll go ahead and call on you to direct a question at that time. If the QR code and take all of the steps to register, create an account, follow the prompts, and then the certificates will be granted and generated automatically. So now it's my pleasure to introduce today's guest speaker, Liz Lees.
I want to feel check them all again.
I did today talk to you about my passion area, which is eating disorders and that gut brain connection. And so I am a discrete dietitian. I specialize, as I mentioned, in disorders. I also have subspecialties in gastrointestinal nutrition. Overlap in these two areas. Disorders, risk factors for the development of eating disorders. We'll talk about both the medical and nutritional consequences of eating disorders, and then bring the discussion into that gut-brain connection and nutritional strategies to help us support even mental health. So why are we talking about eating disorders? Well, within mental health, eating disorders are the second leading cause of death amongst psychiatric illnesses, next to opioid addiction. Overall lifetime prevalence of eating disorders is estimated to be about 8.5% among females and just over 4% for males. Every 52 minutes, one person dies as a direct consequence of an eating disorder. And interestingly, and probably debunks a lot of common beliefs around eating disorders, is that 6% of people with an eating disorder are actually medically underweight. Right, so we have that kind of classic image of a very thin female that's having an eating disorder, but this just isn't the case. And eating disorders have really surged in the last couple of decades, likely a lot to do with rise in social media and other mental health concerns going on. But it's really prevalent and important to talk about. So we're going to talk about the different types of eating disorders. We'll talk about anorexia nervosa, bulimia nervosa, binge eating disorder, avoidant restrictive food intake disorder, and then other specified eating disorders or OSFA. So anorexia nervosa, this is probably the most common one that we think of when we think of an eating disorder. The diagnostic criteria for anorexia is a restriction of energy intake relative to one's needs, coupled with an intense fear of gaining weight or becoming fat. There are often disturbances in their body image or a lack of recognition of how low their weight is. And in anorexia, we can have subtypes. So there can be restrict type, which in primary behavior is restriction altogether of calories. And then there can be a binge purge type. They're one or the other or both. So that they still fall under anorexia even if they have occasional binging, because it's also have very low weight. So then bulimia nervosa. Bulimia is defined as recurrent binge eating with inappropriate compensation afterwards to control to control gaining weight. And so a binge is defined as eating a large amount or larger than what would be considered normal in a specific time frame. and also associated with a general lack of control. And then, as I mentioned, there's to be diagnosed with bulimia, there is then that compensation to get rid of food that was eaten. That can be done through various purging techniques. Purging could be self-induced vomiting, it could be use of laxatives, diuretics. There could also be excessive exercise or excessive fasting. And similarly to anorexia, this is driven by attempts to influence our weight or shape of our body. Binge eating disorder. So binge eating disorder is, again, similar to the binge definition with bulimia. However, there is no follow-up measurement afterwards to get rid of that food. However, there is a sense of shame, guilt, a lot of negative associations associated with the binging episodes. And even though it's not technically within the diagnostic criteria, oftentimes you will see these individuals may have restriction or fasting after these episodes because of those negative feelings. All right, ARFID. So has anyone in here heard of ARFID? Few heads, awesome. ARFID is relatively young as its own diagnosis within the criteria. It was previously kind of coupled under just general pediatric feeding disorders, but we know that ARFID can affect people from a young age through adulthood, so it's not based on age anymore. And ARFID is different than anorexia in that the behaviors to restrict food or avoid food are not driven by a desire to control their size, their shape, their weight. That's not to say that we all have bodies, right? We all might have some sort of body image dissatisfaction. That's not to say they're not allowed to have any bodies. Dissatisfaction, however, it's not to the point of engaging in recurrent behavior to control weight. So ARFID is kind of a broad definition here. We can have various different characteristics of ARFID where it can be driven by just a general lack of appetite or hunger cues, disinterest in food. Another characteristic might be sensory aversions. So we have a lot of avoidances based on textures or sights or colors or anything about that sensory aspect of the food that might be uncomfortable or unfamiliar for individuals, leading to an avoidance of eating. And then the other characteristic can be fear of adverse consequence of eating, right? And this might be, I've had chronic stomach aches and I have an intense fear that every time I eat, I'm gonna get that stomach ache. And so I'm really restricting the types of foods, the amounts of foods that I'm eating, or fears of choking or fears of food being like contaminated or poisonous. And so in order to be defined as ARFID, it's not just like, oh, my kid's a picky eater, eats, a handful of foods. The degree of selectivity with foods or the restriction of total amount of foods eaten need to also be associated with either significant weight loss and growth failure or producing significant nutritional deficiencies. They may have dependence on either oral nutrition supplements like an Ensure, a Boost, Pediasure, those things, or on tube feeding. And oftentimes we are going to see a lot of interference with their general psychosocial functioning, right? So any events that are surrounded with food perhaps become really overwhelming and difficult to engage in, or the implications on our mental health, right? We're eating such little food that, our brain is starved of nutrition, which we'll talk about in future slides. And then we kind of have our catch-all, that OSFED group. So the OSFED eating disorder diagnosis is essentially, we didn't meet any of the full criteria for the previously mentioned eating disorders. However, the behaviors are still clinically significant because maybe we don't have that low body weight to be able to fall into an anorexia diagnosis, but I'm still really heavily restricting my food and it's causing nutritional imbalances and a burden on my mental health, physical health. And so the new term within this category for that is atypical anorexia. Those of us in the eating disorder field do not like the atypical term because it's actually very typical. It's more typical than classic anorexia. And it truly comes down to someone's BMI, which is really quite silly for that alone to be a marker of her health, right? We can live in any size body and be at just as risk for medical nutritional consequences of feeding behaviors. Do people get eating disorders? Well, it's not a simple answer, is it? It's very multifactorial. And so the next few slides, I'm going to go through the top 9 risk factors that have been identified from looking through lots and lots of research and showing, okay, what comes up the most? What do we see associations with? So genetics, right? Everything comes down to genetics at some point. People with family history are 11 times more likely to develop anorexia, 9.5 times more likely to develop bulimia, and just over 2 times more likely to develop binge eating disorder. A little bit that we'll touch upon with that whole gut-brain connection is gut dysbiosis. So for those of us not familiar with the term dysbiosis, it's referring to just basically when we're looking at our gut bacteria profile in our body, that there's maybe a low diversity of all of the beneficial strains of bacteria, or perhaps higher levels of more pathogenic, less healthy bacteria and lower of the beneficial. And so there's some emerging research over the years that has been showing that perhaps from a young age, or anything that may be really significantly influence the health of our gut bacteria, that this could be contributing to certain hormones that the gut bacteria can release that might influence someone's ability to, say, not gauge hunger symptoms. And so they might have that ability to restrict without having such, intense of physical symptoms. Or conversely, individuals with dysbiosis might be more prone to have binging behaviors because they lack some of the hormones that help with feeling fullness. So kind of an interesting area. I gave a presentation just on gut dysbiosis a couple of weeks ago. All right, chronic medical conditions. So I named just a few here. However, pretty much any chronic health condition we can think of is likely going to influence someone's risk for an eating disorder. And because most chronic illnesses have some sort of a effect on our quality of life, right? And we know that it's associated with maybe increased rates of depression, depending on those chronic illnesses. Now, chronic illnesses that have a dietary component to it, such as, I have to be more heavily focused on exactly what I'm eating, certain diet plans based on, say, if I have diabetes, right? And I'm more mindful of carbohydrates and whatnot, or certain gastrointestinal diseases, and I have to follow strict diets, or I have really bad symptoms that I've been living with. And so I've started making those dietary modifications in order to help control or manage the disease. And we know that increased preoccupation or following diets are predictors of development of disordered eating behaviors, right? It's not to say that every disordered eating behavior turns into an eating disorder, but that's how it starts. Childhood weight status, both high or low, has been predictive of later in life development of an eating disorder. Relationship with parents. So years and years ago, the unfortunate conception was that parents cause eating disorders, but this is not the case. It's not true. Now, that's not to say that there can't still be those risk factors and environmental conditions, at home. Perhaps parents exhibit dieting behaviors or have a lot of talk around, the thin ideal or, food, a more negative connotation, right? And it's not that it's coming across intentionally to be harmful, but you know, children internalize these messages that they hear. They, especially girls with their mothers, they really learn a lot about how to appreciate their body based on mother's relationship with her own body. So these are just really ones to be mindful of, right? Is that more of that nurture aspect of risk factors. And then on the other side, it has been found to be protective to have family dinners together, which is hard with sports and multiple activities and everything going on. But you know, even if it's once a week, twice a week, right? It's just a great habit to sit and eat together, community of that. But also we find that talking about just general healthy eating behaviors and leaving sort of the good bad talk out around food and just talking more about, you know, eating a balanced meal can be very helpful protective factors. Okay, any history of neglect, abuse, trauma. This is not to say that everyone with an eating disorder has trauma in their past. Maybe trauma can look different for everyone, right? It could be hard to describe as trauma with a capital T, maybe something that was more what we would consider to be a really traumatic event, like an abuse, right? But it can be other traumas like prejudice that I've experienced from maybe being in high risk type of gender or sexuality type group. And the exposure to trauma has been found in utero through adolescence to be a risk factor. So, you know, perhaps there was trauma while baby was in mom's belly of exposure to abuse or drugs or, you know, traumatic birth. Personality traits. So this is a one that we tend to see often with, depending on the type of eating disorder, when we think of more of those restrictive kind of behaviors, that could go very hand in hand with personality traits of perfectionism, maybe kind of neuroticism or high achieving, right? Really holding myself to high standards, perhaps competitive. Whereas behavior traits like impulsiveness have been shown more towards the binging behaviors. And then comorbid conditions, different than those chronic medical conditions, but this is referring to co-occurring mental health conditions. So depression, anxiety, personality disorders, definite big risk factor. In fact, you know, I saw some research saying that 50% of people with an eating disorder have one or more of the anxiety and probably higher than reported on, right? In my practice, it's rare that I don't have someone with an eating disorder that doesn't like diagnosis also our last two risk factors, I kind of touched upon this, but our gender, our sexuality, right? So we do see higher rates of eating disorders amongst females, but that's not to say they don't happen in males. And this also might just be because we identify it in females more, right? Females might be more apt to go to the doctor, right? Especially maybe in later years, but also men oftentimes might be dismissed at the doctor of, oh, men don't get eating disorders, like that's not an eating disorder, right? And so probably a lot of this isn't getting caught, where there's just that stigma of like, this is a girl thing, right? And so I can't possibly have an eating disorder as a male, but we know that's not true. And then amongst our LGBTQ plus population, there are very increased rates of eating disorders. Some of this can come down to maybe if I identify with the other gender, trying to use food to control my weight as a means to look more or less like that particular gender that I identify with, or those kind of micro discriminations that these individuals constantly come across in their day-to-day living, right? That's trauma. And then our good old social environmental, right? We live in a diet obsessed culture, right? We are constantly bombarded about how's the GLP-1s, right? It's a multi-trillion-dollar market of weight loss, so it's everywhere. There's this desire that we need to be thin to be loved or successful or happy in life, right? We're constantly exposed to that. Social media, right? Influencers talking about right? Diet plans, workout plans, posting, right? Filters. Even when people recognize that there's a filter on photos, it still impacts their perception of themselves, right? It's what is protective is educating ourselves on what we call social media literacy, right? How we interpret the messages that social media, that's huge, and that can really make a big difference in our results. As far as, hey, I've seen these people talk about, they need to eat this in a day to be healthy or lose weight. What is their credential, right? So really kind of questioning that message and how I'm internalizing that information can be really protective. And then I thought it was kind of a cool statistic that they mentioned as well within this kind of subcategory, that what was also a protective, like TV shows for the whole tended to be negatively would influence body satisfaction. However, individuals like Black individuals that would watch shows that primarily feature Blacks in there as well, that was a protective factor of, just feeling that sense of like more body positivity. I thought that was really, really neat. All right. So those are some of the risk factors, right? We might not see these things per se or really think about it, but what do we look for maybe amongst, our children, our friends, our loved ones, etc. Kind of behavioral changes might be some triggers of something seems a little different or off to work on identifying if there's maybe some disordered eating going on. So, an increased preoccupation around weight loss or food, maybe they're calorie counting, on and off diets. Again, I'm not suggesting that anyone who's calorie counting developed an eating disorder. And oftentimes, I would say, I think I've seen in the literature that 90% of people with an eating disorder at some point have been on a diet or watching their calories. So it is an important thing to pay attention to. Sudden refusal to maybe eat certain foods, elimination of whole food groups, suddenly becoming, I'm now not eating all foods. Now, we also know that we can still follow things like vegan diets or other vegetarian diets in a safe way, but it's looking at the whole picture. Someone maybe frequently questioning or making comments around, fat, weight, do I look big, right? If that changes body preoccupation, checking in the mirror. Oftentimes there can be called body checking. There can be a lot of those behaviors that you might pick up on. Swings, right? Just change in overall, maybe isolating more, right? Or more irritable. Now, of course, that's hard in teenage years to maybe discern between the two, but it's like something just really seems like it's drastically changed. That person's personality is just off. How about the nutritional and medical concerns? So we know that regardless of BMI, which is a silly measure to begin with, but regardless of our weight, our body size, we can experience malnutrition, right? And so malnutrition will look different for other people. Than some people might be more predisposed to having certain repercussions of their health than others. And so we really want to, it's important that individuals with an eating disorder have a informed doctor, medical professional, kind of helping them to really look into all of these different aspects. So nutrition affects us from our head to our toes, right? Things like hair becoming brittle, falling out, right? That can be a common one I see. Skin changes, maybe mouth is dry, cracked lips, changes in what our tongue looks like, depending on nutritional deficiencies. Nails might change. Oftentimes I see this a lot, especially with those who are maybe still engaging in excessive exercise as a means to control their weight. That like I have like constant muscle pain, or I can cramp really bad every time I'm going out, even for that walk. Right, just feeling fatigued after any kind of physical activity. Okay, that's not normal, right? Unless we're pushing ourselves beyond what our body is supposed to be doing. Immune system, right? We can have weakened immunity or wound healing because everything in our body uses nutrition. If we are running in a deficit, everything's going to run in a deficit. Things like proteins make a lot of our antibodies for immunity. And so if we're not getting enough proteins in, even if I may, again, appear to be well nourished physically, that doesn't mean internally I am. The mental side, again, we're going to dive deeper into that, so I won't go into that right now, but lots of mental health effects. Our heart, that's a big one. Heart slows down, there can be irregularities in our heart rate. That can be one really dangerous side effect of really restrictive eating disorders too, of just that loss of muscle tone around our heart. So now our heart is having to work harder to pump up blood throughout. And on top of that, if we're exercising, that can be a really dangerous one. Our digestive system. So I spend a lot of time talking about this one with my clients because I tend to see ones that come with both. And that's because there are so many physical changes that occur in our digestive tract. Everything slows down, right? Our body is trying to adapt to starvation, malnutrition. And so we might have, if that motility is slowing down, now I'm feeling bloated or constipated or just really full or getting reflux, right? Really uncomfortable symptoms that kind of seem like they came out of nowhere, right? Oftentimes people will say, you need to go to the gastroenterologist, maybe, but let's work on getting you eating enough first and let's see what happens, right? A lot of times these things will kind of self-regulate, not always, especially depending on the degree of restriction and for how long. But first and foremost, we know we have to just re-nourish the body. Our reproductive system. So, and this kind of goes hand in hand with bones a lot of times. So especially in our adolescent years, when we're supposed to be really building bone strength, that loss of a menstrual cycle is a big red flag of what's going on, right? So our body essentially is not making enough estrogen. What that does to our bones is causes more leaching of calcium, which can make our bones get more brittle, more likely to fracture or have earlier onset of osteoporosis. There's been clients that I've had in their 20s that have beginning stages of osteoporosis. So this does happen. And especially again, if these individuals are highly active, sports injuries, very common, really delayed healing. And so the importance of exercise rest when we are in this body weight with evidence of probably bone health is being affected if that menstrual cycle is not present. Yeah, and then our nervous system, which again, we'll kind of talk about the brain. I thought this slide was kind of interesting to just show like what are maybe some nutrients that we would find more deficient based on types of eating disorders. This is not an exhaustive list by any means. With anorexia, it's really going to be most of our nutrition, right? Because we know we're restricting to the amount of calories that doesn't even sustain normal functioning. And so pretty much any fat, protein, micronutrients like calcium, iron, B12, right? Vitamin D, these things can all become deficient in individuals who are restricting. Laboratory measurements can be helpful to get an insight with, you know, are some of these things impacted, but not always. Like we can't really take a blood calcium level and be like, oh, yep, your calcium's low, your bones are, you know, you just go more so off maybe vitamin D status or that loss of menstrual cycle in a female. Within bulimia, especially if we're either engaging in like self-induced vomiting or laxative abuse, we might have loss of more electrolytes from our body. And so more often we might see some electrolyte imbalances. Now, if there's co-occurring like substance use, So we would definitely really worry about a lot of B vitamins, reduced absorption of these. Within binge eating disorder, might not be quite as common, but that's not to say that there aren't. Like I've had plenty of binge eating disorder clients who are iron deficient, right? Because maybe they also texturally really don't like protein foods, right? And oftentimes binge foods tend to be more kind of just what's easy to grab in that moment, right? Because there's that loss of control. It's kind of like what's convenient. That might be more of the snack foods, right? That aren't going to be good sources of iron or protein. And then within ARFID, again, this is a generality, but most often these individuals are eating a more, especially with the selective eating, where I might have like 5 or 10 foods that I eat and that's it, right? There can be a big widespread deficiency among protein and iron, and vitamin C actually comes up a fair amount within ARFID because there's avoidance of fruits and vegetables, and I'm mostly eating maybe packaged foods because I know exactly what to expect out of a packaged food. It's always the same texture and it looks the same, it feels the same in my mouth. So a lot of these vitamins tend to be higher risk of deficiency amongst ARFID. So let's shift over into brain health, right? The theme of our conference. So I want to talk about 3 different nutritional components that really play a big role in our brain health. Right, so first one here, vitamin B12. Vitamin B12 has more effects or more functionalities than just our brain, but for the sake of this presentation, I'm just focusing on the brain. And so we know B12 is important in the production of making the myelin, which protects and insulates our nerves in our brain. They help with neurotransmitter production. So those neurotransmitters like serotonin, dopamine, GABA, helps protect against brain shrinkage and inflammation. B12 keeps inflammatory measure called homocysteine level lower, which is neuroprotective. And then in some DNA and energy production as well. So what happens if we're deficient in B12? There's going to be, again, widespread symptoms that can occur, but specific to the brain, this can impair our memory, might have more confusion or mood imbalances. Omega-3 fats. So this is a big one for brain health. Omega-3s are both a structural and functional component to our brain. We know that deficiency of omega-3 fats is associated with higher rates of depression, anxiety, generally associated with ADHD. And so very, very important that we have that adequate omega-3 to help with overall functioning, but also with managing our mood, our both brain mental conditions. It has a anti-inflammatory effect for our brain, especially in earlier years of life. Omega-3 fats are imperative to develop. And then our final one here that I want to focus on is protein, right? And I know this is kind of broad, but it's super important because our neurotransmitters are made from proteins, right? So again, those neurotransmitters like serotonin, dopamine, GABA, epinephrine, all of these things are made from proteins, right? And so if we aren't getting enough total calories and enough protein calories, and again, especially if maybe our eating behaviors are more geared towards kind of, the chips, the cookies, the kind of more processed foods, and I'm missing some of these protein-rich foods, this can definitely play a role with or without an eating disorder, right? Can play a role into the functionality of our brain and ability to manage our mood. So we do see increased disturbances in mood, anxiety, depression, learning difficulties, brain fog. You can look at that term. I feel like it's kind of trendy, but kind of just, maybe not being able to think as clearly, feeling a little cloudy. And then the name of this presentation, right? Like, what is that gut-brain connection? So we talked about, this neurochemical production in the brain. Well, our gut is also a big producer of serotonin. So those of us that just heard the almond discussion, right? It was discussed a little bit about serotonin is primarily produced in the gut by the gut bacteria, right? And so if we have less of our beneficial gut bacteria that are involved with producing these neurochemicals, of course, that's going to have a huge impact in our brain. Sleep, to feel calm, right? We might be more in that kind of fight or flight state oftentimes, right? Associated with stress. We know too that stress can impact gut motility, right? So this is what we call bidirectional pathway. The gut influences the brain influences the gut. And so, we've maybe all been in that situation where we have a big test, or we're, I hear with a lot of marathon runners right before that race, right? Like, oh, I have to go to the bathroom, or I feel unsettled, right? This is the gut and the brain communicating, right? And a lot of this communication is modulated through the bacteria that live there, and also through other hormones and signaling processes. But that gut bacteria is a primary one. And so taking care of our mental health helps with our gut health and vice versa. And again, like I had mentioned more in the beginning of some of those risk factors, this does come up time and time again in the literature about how dysbiosis or poor balance of our gut bacteria is linked to eating disorders, depression, anxiety, ADHD, and more. So how do we support gut health for mental health? Well, in general, when we're supporting overall digestive health, we think of fiber, right? Fiber is one of the food sources for the gut bacteria, right? Fiber can be found in all of our plant foods, fruits, veggies, legumes, right? Like those plants, lentils, whole grains, nuts, and seeds. Also, we can get actual live bacteria strains in our food from probiotic foods, right? So things like certain yogurts that have, that lactobacillus in there. It's one of our bacteria strains that has a lot of health benefits in our body. Other fermented foods like kombucha, kimchi, kefir, right? Kefir is like a yogurt drink. I even haven't seen it before. The dual grain called kefir that have a lot of great anti-inflammatory properties to it as well. Those prebiotic foods, so not all fiber is a prebiotic, and prebiotic essentially just means the food that feeds the gut bacteria, right? But prebiotic foods we could get are some of the fiber components of plant-based food, but also we can get prebiotics from, if anyone's heard of polyphenols. Those are almost like the plant's version of a antioxidant, right? So the plant produces polyphenols in response to any kind of environmental stressors. When we consume it, our gut bacteria love those polyphenols, and we see a lot of great health benefits. And then just in general, kind of an anti-inflammatory type diet pattern, which has, higher rates of those omega-3 fats, right? We talked about how great that is also for brain health, also great for gut health and just overall chronic conditions in our body. And then fun ones like turmeric. I know that's kind of become a trendy one. If anyone sees golden milk out there, that's turmeric and milk, and you can make lattes or just, tea out of it. But turmeric has a lot of cool research around it as being a really great anti-inflammatory food. And all in all, the goal here is just to play around with some variety, right? Research shows that aiming for 30 plus different plant foods a week can be really helpful for optimizing gut health. 30 a week might sound kind of intimidating, but if you think about it, it might be like, I sprinkled some fresh parsley in my pasta and I added a spoonful of chia seeds to my yogurt. I had yogurt, right? Or, well, not plant food, obviously, but the probiotic. I had, a salad and I added a couple extra vegetables to it, whatever, right? I mean, and by no means, if I don't hit 30 plant foods a week, are you not gonna meet this goal, right? I don't want it to ever feel like a stressor, but it's just what's kind of reported in the research. And of course, it's also very much an association of, we tend to see more variety of plant-based foods associated with improved digestive health and symptoms and chronic health conditions. Things that could be gut disruptors can be excessive alcohol intake, smoking, certain food additives like food dyes, and some emulsifiers, artificial sweeteners, right? Like me, I always tell people, oh, the real sugar, and instead of those artificial sweeteners. Now, of course, and maybe depending on certain health conditions, that works for people, and there's no judgments either way, but we do know that artificial sweeteners are not great for the gut bacteria, even though we are maybe not absorbing it into our body system. There can still be an impact on the gut bacteria fermenting it and what comes out of that. Overuse of antibiotics is associated with dysbiosis, right? Now, of course, there's a time and a place where we need antibiotics. They can be life-saving, and not running to them every time there, because certain antibiotics can change the profile of our gut bacteria for up to 2 years. So it has some long-term effects to it. We want to just be mindful of. Beyond the dietary factors, some great ways to support our gut health supports our mental health, right? Staying hydrated, right? Plenty of sleep. We just heard that again in our previous presentation, just how important sleep is for overall health, but also for our gut health. Some gentle movement could be great, right? And this can be scaled up and down based on what our body can tolerate, right? It's not to say I have to go and do high intensity, really rigorous exercise in order to get benefits. No, some stretching or anything that just incorporates mindfulness, right? Just that gets our brain out of that fight or flight, go, go, go state and into a relaxed state has such amazing effects for gut health and symptoms, of course, our mental health. And that mindfulness can also be translated into eating, right? And so mindful eating is basically, active eating, trying to remove judgments and really focusing on those sensory aspects of the meal, right? And this can be a fun thing to practice for ourselves. I've led adolescents through this before of just, as we're trying to get towards more intuitive eating and really working on just their mental state of thoughts during a meal of, hey, let's like really hone in on what do I feel in my mouth, right? What parts of my tongue are stimulated by this food? What are the sensations that I'm getting? What kind of flavors are coming out? What's the temperature like, the texture, right? I mean, you can get really deep into it and just kind of helps really get, it's like meditation, right? Where we're just trying to be really in the moment. But lots of benefits. And we know that mindful eating also will help us with slowing down, chewing our foods well, which also helps with just digestive symptoms in general. And some fun things, I like to make food fun, right? So for people who enjoy cooking, right? Like try some new recipe, make your own kefir or kombucha. Maybe if we're having a lot of gut symptoms, right? Doing some food journaling of my mood and my gut symptoms and kind of seeing if I see observations. And oftentimes people that I work with, they have such anxieties around foods that seem to be associated with poor, like negative GI symptoms that there's a lot of avoidance. And so this could be a helpful technique because it can almost create insight of like, hey, you're still getting some of these symptoms one day, but not on the other day with the same exact food, right? Maybe there's something more than it just being about. Okay, so give us some good insights. So now I'd love to answer any questions, and I thank you all for being here. I'll go check the chat in case any questions popped in from there. Yeah, so the question was if people take like omega-3 supplements like in a pill form, if that's still helpful. Yeah, there is research that still shows that, we can have improvements with like our heart health. I think it's harder to necessarily directly correlate to like, not to say that it hasn't in some research of like improvements in depression scores. It's always hard to say like, is this the only thing that, helped with this? But It certainly for most people wouldn't hurt if it's something that, if you're like, yeah, I don't like fish, I don't, whatever, right? I don't cook much, so I'm not able to use olive oil or, canola oil or other things that are gonna make it great fat sources. And especially if we have really restricted food preferences, then sometimes a supplement is the next best option. So absolutely, yeah.
Yes, more so thinking like, is there was memory. Problems.
Yeah, so and of that, and absolutely, and then some stuff like, hey, I'm not getting food first, is that my philosophy, and also to take the judgment out of some people might not enjoy those types of foods, and so then if that supplement is something that works for someone, and you might see like, okay, it's improving my mood, or I feel a little less foggy, absolutely, give it a shot, as long as it doesn't interact with, any medication. Yeah.
So, so I am anemic or anemic. I don't know how to pronounce it, but I'm just wondering if that's like something that I developed from my eating disorder. I'm healed from my eating disorder, so I don't know if I like.
That's a great question. So, talking about, conditions that maybe could continue and persist despite having healed from an eating disorder. The main ones that we see that really are more irreversible tend to be bones. And then in the case of like throwing up, like tooth damage. Now, the GI effects sometimes can be persistent for people depending on how long they've lived with the eating disorder. But oftentimes nutritional deficiencies will improve. But that also is going to be like, are there absorption issues going on that maybe are not related to the fact that I had an eating disorder and restricted food, or didn't have those foods in my diet, but maybe now that I'm eating them, if I'm still, it's just an iron deficiency. Yeah, so it might be, am I not absorbing iron very well for whatever reason, or maybe I'm not eating iron-rich foods. Pairing vitamin C with iron helps with improving the absorption. So like when I'm eating my chicken, my fish, my beans, whatever, like, can I throw some fruit with that, or maybe marinate with some lemon juice, or any kind of fruit veggie is generally going to be a good source of vitamin C to help with that absorption.
So it just improves.
Yeah, so pairing our fruit and veggie with our protein. And so the highest sources of iron are going to be like meat, fish, poultry. And then we also get some from most all
So
like
all
eggs. Yeah.
So I just have a meal plan.
Okay, exactly. Yeah. Yeah. So if we just pair the two together, or if people take iron supplements, there are more these days that have vitamin C in them. If not, just take vitamin C or eat an apple with it or something like that. Yeah, great question.
I'm not sure what my question is. I'm gonna form it. There you go, but this is more about like the media, social media. During the youth panel, one of the girls said that substance abuse is sometimes romanticized. And I think that said as well about eating disorders, social media. And now, as you mentioned earlier, runs and how accessible and how people are on it. And I think my question is more about how do you have those conversations with teenagers or even middle school kids that are in the development process, maybe even young adults when they're still unsure about it. I mean, I obviously like restrict your social media or social media literacy, like I mentioned, but yeah.
That's a great question. And I think that especially depending on the age of our kiddos, like restricting social media. So a lot of the research shows that 2 hours or more a day of social media is associated with lower body image or body dissatisfaction. So maybe that's like, hey, we're limiting to an hour, right? And also like, filtering out harmful content, right? So like learning how to navigate, TikTok, Instagram, all of them, they have, I can say, I don't like this, right? I can change that algorithm because the more things that even if I'm just scrolling and I keep up for a little bit, the algorithm's like, ooh, they liked this more, right? I didn't even have to click on it. And so cleaning up social media, right? So starting to follow like more positive things to help reduce the other ones, but like that stuff's showing up because at some point we've looked at it, right? And so a lot of it is kind of like the teaching around how to clean it up. Maybe I delete that account and I start a whole new one. It's not to say it won't still pop in there, but we can make it not where it's like the entire content where it feels like, oh my gosh, this is all that's on social media. Oh no, that's all that's on yours, right? But yeah, kind of like saying, I don't like this, getting rid of it. Also like, yeah, like that media literacy, social media literacy piece is, it truly is very effective to, okay, let's just, who's this person? What are their credentials? Why are they sending this message, right? Like, do they own a wellness company and they're trying to get you to buy their supplement? Of course, they're going to say whatever it takes to kind of get our attention. Yeah. Yeah. And you can create like restrictions on phones and turning off, you know, certain controls, you know, after a certain time. So I think that is important as parents because ideally, hopefully, I know there was a bill in progress about trying like the social media act, the name of it, but trying to kind of clean up like what's even accessible to youth. But you know, until there's more of that, I think I have to teach and sometimes just be a little more forceful of like how much you're going to be able to see. Yeah.
Do you have any information on magnesium glycinate supplements and any benefits?
Yes, yeah, great question. So magnesium glycinate supplements. So I use this a lot for my patients. There's different forms of magnesium in a supplement. We can have the magnesium citrate, which is maybe the more common one we've known of. That one's going to be more for like helping with if I'm constipated, right? To help with motility. Magnesium glycinate, a little more gentle on the gut. So, and it has some research around it showing that it might help with sleep. It might help with some relaxation. So magnesium itself is involved in the metabolism of energy, but also it's involved in some of our sleep, like formation of sleep genes, sleep hormones, whatever we want to call them. Anecdotally, I think a lot of people do get some benefits from it. Research isn't like clear cut of like, yes, this will fix all. I mean, magnesium's I think a really trendy one that's like fixes all these things. And for some people, it truly can. And it's one of those that we can't really check a magnesium level in our blood. It's very tightly regulated. It's not gonna, if it's out of whack, then that's what's going on. And so when we can't necessarily measure if it's adequate or not in a way that reflects our whole body status, then, you know, sometimes I also look at like, what are our eating habits? Higher stress, go lifestyle is also generally more of a magnesium depleter. And so those are things too that it's like, okay, let's try out a dosage that's reasonable. Again, as long as it's okay by the doctor and we don't have any sort of conflict with the medical conditions that would make that a risk. But yeah.
And what is your opinion now?
Yeah, I'm a fan of it for a lot of people.
Yeah, I had a family member, that has two issues. One, person, is no longer fighting to cut it up into pieces or a hot dog or common things you would like. The other part is open to, let's say, two, never eats the two. Is those considered be eating disorders or psychological issues?
Yeah. So, you know, to be an eating disorder, we have to meet those criteria where like the behaviors are with enough frequency and for long enough time where it's really having a significant impact on our mental and physical health. Now we can still have like disorders or normal behaviors going on, and there might be, you know, sensory things or especially like I work with a lot of neurodivergent kiddos that, not even kiddos, adults as well, that, you know, sometimes visually how something looks or how it feels in their mouth, they might need to make little modifications to reduce, kind of soothe their own anxieties with food if that's coming up. It doesn't mean that they always have an eating disorder, but sometimes we do make modifications in like our eating habits to maybe help with soothing our brain if it's something feels like this is uncomfortable.
Do you think that should be mandatory?
Yes, I mean, there's.
Yeah, they teach about nutrition, they teach about, sex ed, all these things, like, well, we're constantly bombarded with social media.
The same like where she goes to works with medical professionals, with primary care, with other health providers, especially mental health providers.
Absolutely. Yeah, I love those comments for sure. Just like the more awareness of the impact that it has. It's like in my field, I'm so ingrained in all of this literature and information that it feels like common knowledge, but for a lot, it's not. So even for individuals to be advocates of like, hey, like, did you know that, social media is really spiked the incidence of suicide and mental health decline. And it's true. I mean, those are direct relations. So I think it's good. And social media can also be really helpful. It's not to demonize it, right? Like that can be a great outlet for teens as well to feel that sense of connectedness with their peers, especially if maybe they are neurodivergent and social experiences are overwhelming, right? Being in public, that's too much stimulus. So that's like, hey, I get my social needs met in this way. Support groups, right? There's a lot of great things out there, but the scary thing is there's pro eating disorder communities out there that and it's not hard to find, right? I mean, I can Google it and it'll come right up, right? So
by the time you probably see the client, they already deep down in the eating disorder. So instead of really, work with that all the proactive way,
right.
You
Yeah,
have
so
to-
like the early prevention, like you're
Exactly.
saying, is so, yeah, I love that you brought that up. It's so key. Yeah, I do think like schools could add more into their curriculum and it's hard. I know that they're dealing with lots of other things too, but in a perfect world, it'd be so nice to have more of that. Yeah.
Because I mean, it's not only malnutrition. I mean, there's binge eating disorder, right? There's different, there's people are overweight and more problems with conditions, for example, right? So it's not only anorexia or, bulimia and all that, but there's just overall nutritional education to really improve your health, overall health, and mental health as well.
Definitely. Yeah, absolutely. Yeah. Any questions? Yes.
Any traits that are suggested better than others, like what would suggest?
Oh, yeah. So the question was about the quality maybe of protein drinks, factors to look for. So there's so many out there. It kind of depends on why we're using them, right? Like if I'm working with a kid that is so restricted with their eating, whether orphan or anorexia, and we just need to get nutritional needs met, then I'm going to look for something that's considered complete nutrition, where it has all of the vitamins and minerals and all the essential amino acids in there. That's things like, I don't know, brand specific by any means, but like the Boost, the Ensure, there's State Farms, that's a big emergency one, right? Version that was protein. And we're using it for post-meal workout. I mean, great. I just want to make sure it's a good quality protein and maybe it has enough carbohydrates to go along with it. Taking the protein back up into the muscles. And, I'd say also go on preferences, right? Like not all protein powders or drinks are created equally. Some of them taste kind of nasty and some of them aren't great, right? And so if you're like, I like the taste of that, then great. Now, I also would say being mindful of, I think sometimes we overestimate how much protein we need, really. And especially with kids don't have super duper high protein needs. They might eat very general statement, by the way, right? Depends on their age and their activity levels and all of that. But it's not, I often hear oh, you eat, half of your weight in protein. Maybe sometimes it works out that way, but that's not a blanket statement by any means. And so, yeah, again, food first, but when there's a time and a place for it, if it's convenient, right? Or I'm having difficulty meeting my needs with food alone, then
Please think, I'll be thinking.
and I'll hang out for a few minutes if anyone has any other questions, comments.
Thank you.
Oh, thanks for saying.